who are
Mountain
here.
West.
Mountain, sorry, what did I say? American Fidelity and Mountain West.
Yeah.
And they are here from Mountain West to talk about the changes in our insurance plan, health plan, all kinds of other things that are going to be really fun for us to do, actually. So, we also have, Al is going to be videotaping this morning, so those of our staff that aren't able to be here because they've got duty and whatnot. So we probably need to keep slide conversations to a minimum, so that comes through. We have good quality, so people that aren't here can hear what's being said and can make the best use of that video when they see it. So, with that, I think that's about it. So we'll go ahead and get started. So thanks for being here.
I'm not sure where best to stand, but I'm thinking outside of this camera.
Well, it'll be fine.
I apologize if I'm standing in somebody's way, but again, I'm Sean Stansberg from Mountain West Insurance and Financial Services, and this is Jackie Marchbanks with our office. We're the consultants for the school district with regard to their self-insured health insurance plan. So for those of you that don't know, the health insurance is self-insured, or what we call self-funded. All your premium contributions, all the district's contributions go into a bucket to pay medical claims as they come in. So they do buy some reinsurance. You'll see the name EBMS on your ID card. That's not an insurance company. That's the third-party administrator that the district's hired to administer your claims. So you have an insurance committee made up of employees that manage the plan, just like an insurance company would manage their health insurance plan. And it's it's a pretty difficult process for them, balancing the benefits with the cost. Healthcare costs are going up for everybody, self-funding plans included. And so they have a pretty rough job trying to balance what kind of benefits they're going to offer to the employees compared to what kind of costs that they're going to incur. So we're going to talk a little bit about what's happening in 2014. First of all, to let you know that the open enrollment, I'll keep moving a little bit in case you the open enrollment period is November 15th through December 15th, so that's the time that you can make changes to the health plans that will go into place on January 1st, 2014. All these elections are effective January 1st, 2014, and they will remain so throughout the year unless you have some sort of a qualifying event or life change event that would cause you to be able to make some changes. As part of healthcare reform, a lot of what I'm going to talk about today is a result of healthcare reform and some mandates and some things that we have to include. One of them is this summary of benefits and coverage at the bottom, SBC. It's a requirement that every employee receive this, so make sure you do receive it. Probably electronically by email. It should be on the district website. They may hand it out as well. The intent of that document is to give you a easy to read, easy to understand document to compare the plan designs. Easy to read and understand is in the eye of the beholder, because I think it's not very easy to read and understand, but it is in a set format, nothing we can do about it. It is what it is, but take a look at that. Who's eligible hasn't changed. Every contracted employees working 18.75 hours or more per week are eligible for benefits. If you're working less than 30 hours, there's a little bit different contribution, premium contribution, but that hasn't changed. The following family members are also eligible. The employee's spouse, new in 2014, would include civil union, same-sex marriage, and domestic partners as eligible spouses by definition in the plan. The next bullet has not changed. Spouses who are eligible for health insurance under their own employer's group health plan are not eligible to be on this plan. And that's been in effect for the last couple of years, so that's not a change. Your children up to age 26 are still eligible to be on the plan regardless of dependency. So they can be married and off in Florida and have their own family. Technically, that 25-year-old child could still be on your health insurance plan. One interesting note is that there is no coverage for maternity care for children up to 26, but they are eligible to be on the plan. See the plan document for complete details. Again, when can you make changes? That November 15th to December 15th date is the time to make changes unless you have a qualifying event. And we've listed some of the qualifying events up there: marriage, divorce, legal separation, status change, birth, death, things like that. You can make changes at that time to your plan or who's on your plan. So for the medical and prescription drugs, There are some changes for 2014. Number one, deductibles and out-of-pockets. Amounts will change in all three plans. Can you guess which direction the deductibles are going? Yeah, the bad news is the deductibles and the out-of-pockets are going up. The good news is, in number two there, deductibles, coinsurance, and copays all are included in the out-of-pocket maximum. Everybody should have, I would recommend you pick up one of these little benefit guides. It's designed to show you all the employee benefits, the life insurance, and the health insurance, and the dental and vision, and the American Fidelity products. And it has a quick summary of the plan designs. So we're going to go over that here in a second, but you'll see that the out-of-pocket maximums, your out-of-pocket maximum before the insurance plan pays 100% is going up. But all those things that weren't included in that out-of-pocket maximum, like the deductible, like the office visit copays, those are now included and count towards that out-of-pocket maximum. So while the out-of-pocket maximum is going up, it's not as bad as it might look because you were paying in addition to that out-of-pocket maximum currently or before the changes. There's a new fourth plan design option called a high deductible health plan. We're going to spend a little more time talking about that. Also referred to as an HSA. HSA is a health savings account, which is a separate entity or separate component from the high deductible health plan, which is the insurance product. So we're going to talk a little bit about that new fourth plan design. You used to have co-payments, or you currently have co-payments for inpatient hospital care. That's going away. So that's a good thing. Wellness and preventative services are now covered at 100%. Your annual physicals and mammograms and prostate screenings and those type of things, you used to have a copay or they might have been subject to the deductible and coinsurance. Those will be reimbursed at 100% in the health plan on January 1st. In addition to that, the pediatric, what we call pediatric dental up to age 19, wellness dental services for children because of healthcare reform is required to be covered at 100%. And the prescription out-of-pocket maximums. In the current three plans, there's a co-insurance benefit that we'll look at. You pay a percentage of your prescription up to a maximum, and those maximums have increased a little bit as well. So here's the current, what's currently called the premium plan. It is being changed, the name is being changed to Premier. Calling an insurance plan a premium plan kind of got confusing with premiums you pay for insurance, and so the committee made the decision to change the name to the Premier Plan. So if you're on the Premium Plan, it'll now be called the Premier Plan, and it'll look a little bit different. The deductible is currently $250, and it'll be increased to $500 on January 1st. The office visit co-payments, if you're in the network, are $25. If you're and they'll be going up to $35, a $10 increase on the office visits. And by the way, the TCN is the Colorado, stands for the Colorado Network. That's your primary PPO network where we're getting the best discounts for your services. Cofinity is the second level PPO network where we get some discounts, but not as great as the TCN. And then OON is out of network, so just for definition purposes, that's what those refer to. You're obviously going to get your best reimbursement, your best level of benefits if you're in the Colorado network. So again, the deductible goes from $250 to $500 for an individual, $500 to $1,000 for a family. Hospitalization, there used to be a co-payment, that's going away. It'll now be just subject to the deductible and co-insurance. Preventative services used to have a co-payment, that's going away, those are covered at 100%. The emergency room used to have a co-pay, it still does, it's a little bit different. It's paid subject to the deductible and co-insurance unless you go to the emergency room. If you're not admitted or it's not considered an emergency, there will be an additional co-payment for emergency room visits. And so here's the out-of-pockets that we talked about. For an individual on the Premier Plan, $1,300 currently, that goes to $29,000, but it includes deductibles, co-pays, co-insurance. And the family goes from $24,000 to $5,000. The prescription co-pays are not included in the out-of-pocket maximum, and they're still covered at the same 20% for generic, 40% for brand name, subject to 150 on a 30-day supply or 350 on a 90-day supply. So that's what the premium plan changes are.
Sean, do you have that sheet available for us? If we, is the one that has the comparisons of the old and the new is not in here, is it?
Oh, no. The booklet just shows what the new benefits are. Yeah. So This presentation should be on the district website, so you'll be able to, I don't think it is yet, but wherever it is that you receive your information on the website, it should be available there. The standard plan, the deductible there is going up from $500 to $750. Say that co-insurance is still 80%. The physician office visit copay goes from 30 to 40. The family deductible is $1,000 to $1,500. Again, these copays for preventative go away. The hospital copays go away. Preventative still covered at 100%. Emergency room covered across the board unless it's not an emergency, then there's an additional copay. Those out-of-pockets, maximum shown here, 25 and 4 go to 42.50 and 8,000 for your maximum out-of-pocket. And then you can see the prescriptions down there. Same co-insurance, 30%, 50%, and this maximum prescription cost to you goes up a little bit there. The basic plan, yeah.
Is there a maximum on the preventative care?
There is no maximum on the preventative care. There is no there's no cost sharing for you. You pay nothing, and you can have as much preventative care as you'd like. No limitation. Yeah.
Do prescriptions count toward your deductible, or is that separate?
They are a separate item, and so they're a separate co-insurance, and the only limitation is these maximum per prescription.
So you don't have to meet your deductible to get your...
That's correct. They're always at a co-insurance situation.
Okay.
You're gonna pay that percentage up to the maximum. That's it. Okay, so again, back to the basic plan, the third plan that's available to you. The $1,000 deductible plan now goes to a $1,500 deductible plan. Those office visit co-pays go from 40 to 50. The family deductible goes from 2 to 3. Again, we have 100% coverage for preventative care. And the out-of-pocket maximums there, you can see go from whatever that is, 4,668 to 6,350, and 10 is the out-of-pocket maximums. Again, these deductibles and these copays are now going to add up towards that out-of-pocket maximum where they were in addition to currently or previously. And then the prescription copays 40 and 60%, a maximum of $250 for 30-day supply and $500 for a 90-day supply. This is the new plan, so we got 4 plans going forward in 2014. It's a high deductible health plan. A high deductible health plan, a qualified high deductible health plan allows you the opportunity to set up a health savings account or an HSA. A health savings account is similar to the flexible spending. We'll talk a little bit about that in a minute. But you cannot set up the HSA unless you were on this plan. Or if you are on this plan and you have some other first dollar coverage elsewhere, whether it's Medicare or military coverage or through your spouse or some other first dollar coverage, if you have that in place, you are not eligible to set up a health savings account. So by having this plan and only this plan, that allows you then the opportunity to set up a health savings account and put away some money tax-free. So we'll talk about this plan and then we'll talk about the HSA, because again, they're 2 separate components. The high deductible health plan is the health insurance component. The HSA is the savings component of it. It's a $63.50 deductible, but everything's covered 100% after the deductible. By HSA or high deductible health plan rules, everything must go towards that deductible, including the prescriptions. So the prescriptions, if you've got a $100 prescription, it's gonna, in this plan, it's gonna go towards the deductible. There's not the co-insurance situation like on the other 3 plans. Everything goes towards that deductible. Once it's met, the plan pays 100%. Pretty simple and easy to understand. There's no other office visit copays, there's no prescription copays. Rather large deductible, but 100% coverage once it's met. The only thing that's different here is again that the preventative care is covered at 100%. So you have no cost for your physicals and your annual preventative and wellness type benefits. Those are going to be reimbursed at 100% under all 4 plans. Any questions about the 4 plan designs? So what are your monthly premium contributions? The good news is those don't change. You already got a rate increase in September, I think, for your October premiums. And so those haven't changed. This is what they are currently, and this is what they are going forward in 2014. If you're on the standard plan and you're a single, you're paying $114. If you wanted to drop down to the new high deductible health plan, it's $39. If you're a family on that standard plan, paying $697, it'll go down a couple $100 if you were to choose to go to that high deductible health plan. The district's continuing to contribute $559. And what I don't have here is if you are dual spouse employees where both spouses work for the district, or if you're working less than 30 hours, there's a little bit different premium structure. That's not included in here, and you need to talk to Barbara about those premiums. But whatever you're paying now is not going to change in 2014.
Is that what did the district contribute in the past plan?
That's what they're contributing in as of July 1st, 2013. Their contribution is $559.
And so currently that's what they're.
That's what they're paying currently.
Okay, so theirs isn't going to change what they're contributing.
Yours isn't changing, theirs not changing.
Well, ours is changing.
Yours changed.
Change. Right. Right. Okay.
They took, I think it was a 10% increase that everybody received in September, October. The district also increased their contribution 10%, but they increased their contribution 10% on July 1st. And your contributions increased in September, October.
Okay.
The dental benefit, only really one change to talk about here. And again, that's that pediatric dental covered at 100%. So dental benefit hasn't changed in terms of your office visit copay is $25 and you have a $100 lifetime deductible and what's included in the class A, B, Cs, etc. But going forward, children up to age 19, there will be no cost share for preventative services for your children. The vision benefit hasn't changed as well. So we still have 100% reimbursement for eye exams, first dollar payment for frames, and lenses up to $150 maximum on the vision. I'm not going to spend any time talking about flexible spending accounts because Ben and his crew from the American Fidelity who handle the flexible spending account and your voluntary products, they're going to be here. I don't know what their schedule is, but they're going to be here in the next few weeks for several days.
The
4th and 5th? Okay. So they're going to be here the 4th and 5th, and they can talk to you about the flexible spending account. Just two things real quick that I'll mention to remind you of. Everybody's got to complete a form. So whether you're enrolling, re-enrolling, you're waiving flexible spending, whether or not you want your premiums pre-tax or post-tax, everybody needs, or you're going to reject it all, it doesn't matter. Everybody needs to complete a form, so you need to see the American Fidelity folks. A lot of questions about what's my maximum flexible spending contribution for unreimbursed medical in 2014. It appears it's going to remain at $2,500. So a couple of years ago, again, as a result of healthcare reform, that limit was reduced from $5,000 to $2,500, and also written into the law said it will increase by inflation every year. Apparently, we're not having any inflation because it's going to stay at $2,500 in 2014. Health savings account. So if you choose to be on that high deductible health plan, you now have the opportunity to set up a health savings account. All it is a savings account or a checking account or some sort of investment vehicle. You can talk to your bank, which is what most people do. You can have it payroll deducted, so you can get your account set up, bring it over to Don Mace and have him payroll deduct whatever amount you choose to put in your savings account each month. Anybody can contribute to the HSA. You can, your mom can, your kids can, everybody can contribute to the HSA. You can use that money on unreimbursed medical expenses just like the flexible spending account. So that $63.50 deductible, you have an office visit, you can use that HSA money for that office visit. Some of the advantages there, again, money can be invested like a 401k or an IRA. The maximum amount that you can contribute to the HSA in 2014 is $3,300, so it's a little bit more than what you can contribute in a flexible spending account. If you're a family on the plan, you can contribute $65.50 into the HSA each year pre-tax. There's also, it's not here, but it's in your brochure, there's a catch-up contribution. If you're over 55, you can put another $1,000 into your HSA as a catch-up contribution. Unused money is not forfeited at the end of the year, so there's no use it or lose it clause like there is in the flexible spending. It's your account, you keep it. If you change jobs, you can take it with you. If you come change plans and you have $1,000 in your HSA and next year you go to the Premier plan, you can still spend that money in your HSA on unreimbursed medical expenses. You just can't contribute money into an HSA unless you're on a high deductible health plan. At retirement age, it kind of acts like an IRA, so you can start drawing it out just like an IRA pre-tax investment for your retirement. And the good news is for teachers is the pre-tax deductions do not affect repair retirement like the flexible spending account will. There's a HSA brochure over here that gives a little bit more detail and answers some more questions. Yeah? You do not. There's no use it or lose it. It'll be, for example, most folks will set up an account at their own bank, and it's your bank account, your name's on it. It's identified as an HSA, and really the only checks and balances are between you, God, and the IRS, because nobody's monitoring what you're spending that money on. If you get in a bind one year and you've got a few $1,000s in your HSA and you need to pull some money out for a car repair bill, you can do that. You'll pay taxes on it, you'll pay a 20% penalty, but you do have access to that money. Any questions on HSAs? Yeah?
Are the regulations ever going to change with administrations?
I wish I knew.
Okay.
I have no idea. I mean, they ate away a little bit at the flexible spending account when they reduced the amount that you can contribute. Because we need more tax dollars. We want to eliminate some of the tax breaks that you get. HSAs were targeted, but they're still available, and you can still put these limits, and those limits are increasing every year. So the 3,300 and the 6,550 are an increase from 2013. So you might take a look, if you're on the standard plan, or even the basic plan, or the premier plan, and you're pretty healthy, and you haven't used the plan a lot, how much difference in premium is there to go to that high deductible health plan, keeping in mind it's a big deductible? What's your difference in premium? Maybe you want to put that into a health savings account, and if you never use it, it's your money. It's a savings account.
And as long as we use it on a medical expense, it's tax-free when we pull
That's
it out.
correct. And it's the same medical expenses as the flexible spending account, so prescriptions and doctor's visits and contact lens solution and all those things that you can spend money on in the FSA, it's the same list of items in the health savings. American Fidelity, again, will be out here on the 4th and the 5th, and they're going to talk to you about the flexible spending account, but they're also going to talk to you about the voluntary products, the accident, cancer, disability income, etc. So I won't spend any time on that. What you need to do, review the current benefit plans, look in the brochure, look at the differences in the health plans and the premium costs, enroll or terminate dependents at this time. This is that opportunity to change who's on your plan or which plan you're going to be in. Make your flexible spending elections for 2014. Everybody needs to complete a form and see the American Fidelity rep. Here's some contact information. Again, just a reminder that December 16th is the drop dead date. Don't wait, especially if you're going to change plans. You want to make sure you have a new plan ID card in your hands on January 1st. So try to get the forms in as soon as possible. Barbara Hunt, of course, and Faith are the contacts for forms or questions or additional information. New elections for the flexible spending account. Everyone needs to complete a form. If you're not making any changes to your health plan, you don't need to do anything. If you're in the premium plan today, you're going to go forward into the premier plan with the new deductibles and the new plan design, but you and your family won't make any changes if you don't want to. And then set up a savings account. If you are going to do a high deductible health plan, sometime between now and the first payroll in January, set up your savings account and get that information to Dawn if you want that payroll deducted. There will be some question and answer meetings, I guess. I don't have those dates yet. I don't think they've determined them, but What the district wanted to do is get this preliminary information out to everybody. They're gonna have some additional question and answer meetings. I'm not sure who's gonna be in attendance there, but, or when those are yet, but you'll be receiving some information on that. And then, so you have plenty of information and plenty of time for that open enrollment period to make some decisions. And that's all I have. Any questions? Yep.
I think I missed it, but how much is that high deductible?
The premium?
Well, yeah, you said they're on the premium, they have
So
the
if
high.
you're a individual, it's $39. Employee and children is $209. Employee and spouse is $265, and a family is $469.
Well, I think that's pain, I was thinking. Okay.
Is there a list of what qualifies as preventative care?
There is, and it's on a government website.
Thanks, Jeff.
There should be a pretty good description in your plan document when you receive it, but pretty much anything you can think of, from physicals to prostate to mammograms, colonoscopies, all those are going to be considered.
And I just want to let everybody know the sign-up sheets to meet with Ben will be in the lounges for teachers to do.
So the sign-up sheets for times to meet with the American Fidelity folks will be in the lounges. Again, that's on the 4th and 5th.
And Jackie's